President Trump speaking a short time ago, making some headlines on the very latest on testing, saying that the federal government is now setting aside $11 billion from the CARES Act, sending that to the states to expand the scale of the testing that's been happening. We got some updated numbers there as well. The president saying that 9 million tests have been performed in the U.S. so far. He expects to pass 10 million this week. He also said that the number of tests have doubled. There are now 300,000 tests that are being conducted a day. Some additional information coming from that press conference there in terms of what the federal government is doing to help support and help some of these states source the PPE, which of course has been really lacking in many ways. A lot of these hospitals overwhelmed because they don't have that. He talked about 90 million N95 masks, working with the private sector, 126 million surgical masks, 90 million face shields, a long list there. I want to bring in Rick Newman here on what we heard, the very latest here. You know, Rick, we heard the president just stress over and over that the U.S. has conducted more tests than other countries that have been affected. But of course, you know, the U.S. has a larger population. So you know, let's talk about just the amount of testing that is needed and how far this $11 billion can help the states get there.
Trump sounds like he's finally getting the message on testing. This is something we can actually do to help contain the virus and create a pathway for reopening businesses and sending people back to work. So we started out way, way, way behind on testing. But Trump is right. We are now conducting the largest number of tests of any country in the world. But when you look at it on a per capita basis, I looked earlier today at the data. So based on population, the United States ranks 18th. And we're behind countries, a lot of smaller countries there, like Bahrain is near the top, some other ones in Europe. Luxembourg is up there, Denmark, Canada is ahead of us. But we're about the same as the United Kingdom. So, I mean, we're getting better. And, you know, I think public health experts want to see us get to a minimum of 500,000 tests per day. So we're at 300,000, we're getting there. But some experts say we need 10 million tests per day if we really want people to be able to go back to work, and that we can separate out who might be sick so that everybody else can work with a reasonable degree of confidence. They're actually starting to do that now at the White House, but not at most other workplaces.
And Rick, kudos to you, because President Trump finally started listening to Rick Newman.
We've been banging on this, haven't we?
No, we have. And I mean, in all seriousness, I mean, hallelujah. I will say, though, that, you know, saying we're the best country at testing, we lead the world, is just patently false. Yes. Sure, you could find one metric to suggest. I mean, you know, 9 million cumulative tests. I mean, our population, by the way, is 330 million, as we all know. And, you know, just because you get tested once, I mean, schoolgirls in Germany get tested, you know, repeatedly. I read that article about them going back to school in Germany. So, you know, we're headed in the right direction, but let's stick to the facts, Mr. President, and a lot of work to be done still.
The irony here is that what they are finally doing at the White House, now that they've had some coronavirus cases there, including among people who are close to both the president and the vice president, they have now finally implemented the kind of testing that the experts say is what we need to do at every workplace. So the moment you have somebody who comes up with symptoms, you test them, you test everybody around them. You know, they even stopped the plane with Mike Pence on it from taking off so they could get 6 people off the plane who might have been exposed to this virus. So we need to be doing that at all workplaces. So that's an idea of how far we have to go here.
Absolutely, you guys. And I would just jump in and say that, to your point, Andy, the number of tests that are being done doesn't necessarily mean single tests or single people. It just counts the number of tests that have been completed. We know that there are places where there are multiple tests being done, including the White House itself, and other industries have taken to that. So that's a really important point. And it also, I'd be interested to see also what the labs are going to be saying about this, because part of that funding that is being used to send these supplies to the states was in fact slated for a lot of the major labs that have done really the heavy lifting here when it comes to the testing. So I'd be interested to see what their comments are following this announcement as well.
Yeah, and Angeli, very quickly to that point, the president talked about these collection supplies and expanding those as well. We think of these testings just like you just go there and you test everything and that's the end of it. But to your point, there's also been a lag in getting these to the labs quickly enough for the test results to be effective. And so what do you think this does in terms of expanding that element? What does it mean for the labs? And then the accuracy of the test. So once we get it, we know exactly where we are.
Right. And I don't think it was clear on exactly which kinds of testing this was. We know that it's the regular PCR test that determines if you are in fact positive or negative, but is it the one that goes to the major labs, or is it going to be the ones that go to the public health or state labs? That wasn't clear either. And so I think it's going to be one of those things that we have to see how it actually all pans out. It sounds great that, this is the sort of the commentary that a lot of the federal level has received criticism for, is not really taking, any kind of direction on this testing or any kind of leadership role. And so this seems to be filling at least that void for right now. Akiko.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.